Good afternoon, everyone. A very warm welcome to the Nat Health Leadership Reach Out series. This is a series where the top leadership from the healthcare industry reaches out to the broader ecosystem, including the frontline workers. And every week we take up issues of vital importance. Most of these issues are forward-looking, and we get an industry expert to share his or her point of view. Today, we are very, very fortunate to have a very eminent leader with us, Mr. Anand K. Mr. Anand is the CEO of SRL Diagnostics. It's my privilege to, first of all, welcome Mr. Anand and also introduce him. Mr. Anand has over 25 years of robust work experience in the healthcare industry, specializing in diagnostics and laboratory services in India, South Asia, Africa, and Middle East. He comes with deep subject knowledge of diagnostic and healthcare industry, combined with strong business acumen, allowing him to view business with a wider lens, then narrow it down to connect the dots, identify business drivers, understand complex issues, take actions, and drive results. As I have mentioned, he's currently the CEO of India's leading diagnostic chain that is spread across 600 plus cities, 30 states and union territories. He joined SRL from Apollo Hospitals Group, where he was the CEO of the diagnostic business unit based at Hyderabad. Anand is a talented and gifted leader with extensive experience in leading diagnostic companies, including Newburgh Diagnostics, Metropolis, and others. He has handled various portfolios covering operations, sales, network, channel development and management, marketing, strategic business development, greenfield projects, including international M&A, domestic and international hospital lab management contracts, PPP, P&L responsibilities, integration, change management, and partner development. Anand earned his graduate degree in medical lab technology from Chipmar Medical College, Pondicherry, with a major in marketing from IIAM Mumbai. He has completed an executive program in strategic management from IIM Ahmedabad. Mr. Anand is actively involved in various industry forums in India and abroad as a speaker or panelist. Thank you, Mr. Anand. A very, very warm welcome to you today into this particular session. We are very, very thankful that you've taken the time out.
Thank you, Siddharth.
The topic of our discussion today, for all those who have logged in, is really taking a peek into the potential third wave that is just around the corner. As you all know, the diagnostic sector is often they often look at the leading lens. I know they are the leading lens in terms of where some of these breakout phases of the pandemic takes place. So we're very fortunate to have with us Mr. Anand, who probably has one of the deepest insight. Without further ado, Anand, my first request to you would be to maybe give us an overview from where you are, as everybody is thinking and really getting worried about wave 3. What are some of the things that you observe, and particularly over the last 18 months to 24 months, given our lessons? What is your observation, and what are some of your thoughts moving forward? Over to you, Mr. Anand. Thank you.
Thank you, Siddhartha. Thank you for your kind introduction, and very good afternoon to all of you. I think let me start with a reflection on the past 15 to 18 months of the previous two waves, and understand how we really went through all this. So as far as diagnostics is concerned, we were in the thick of the pandemic, as we all know. It has drastically altered the perception of diagnostics. For diagnostics, from being in the sidelines of healthcare segment to gaining the center stage, the segment is actually getting its due after this pandemic. But this also came with many challenges and many learnings along the way. At the peak of the crisis, we saw that our staff were overstretched, battling to save lives and control infection rates. So it became imperative for us to protect and safeguard our frontline staff. So back in March 2020, when our nation was hit by the pandemic, the immediate lockdown disrupted our sample movement across states, and our industry faced a massive decline in walk-in B2C business as the footfall drastically dropped. And this is combined with the restrictions on elective and OPD services at hospitals and clinics. The business that used to come from hospitals and clinics were also majorly affected. So as the situation was developing and we got to better understand this, protocols on testing strategy, process, and pricing, they kept evolving and changing. Not to forget that our industry faced shrinkage of manpower as healthcare workers were affected, quarantined, or simply terrified to work. At that point, as an organization, it became imperative for us to make fast decisions and at the same time be transparent and empathetic to our communications and endeavors. The initial challenges, however, were transparent, and as we move along, we found ways of solving those problems. We saw all of this as an opportunity to constantly innovate and find new ways, especially for testing, for reducing the TAT, and keeping our employees safe. That when it became clear to us that digital tech will be pivotal in ensuring that the diagnostic industry continues to function to the best of its abilities, providing both healthcare workers and patients with the vital support that they require during the pandemic. Be that as it may, we were also taken by surprise over certain aspects, like even though as a healthcare industry we were aware that coronavirus is something we were all aware, and we were all tracking its global developments since January of 2020. We knew that this was coming, but as things were constantly unfolding, we were not sure about the decision on the nationwide lockdown. So when in March, when the Prime Minister Narendra Modi ordered a nationwide lockdown for 21 days, limiting movement of the entire 1.3 billion population. So, it was a stamp on the seriousness of this issue. And the sudden lockdown required us to reorient ourselves. How do we reorient in terms of how we work and how we, actually deal with what we do on a day-to-day basis? To serve the nation, our doctors, phlebotomists, our paramedical staff, and other support staff actually were leaving their homes each day and attending work, almost risking their lives. So one of our biggest worries was to ensure the safety of our employees. And as corporates, we also realize the importance of contingency and business continuity planning. So in the post-COVID era, as you may call it, we still are going through different phases of COVID. There is a need to begin by reviewing and renewing the business continuity planning, using the lessons learned from our COVID experience to bolster plan and increase efficiencies. The pandemic actually has fueled the clinical lab 2.0 model, which we have been talking about since 2015. There has been talks about moving from the current clinical lab 1.0 to clinical lab 2.0 model in the lab business. So that is actually a transformation that has been fast-tracked, and that is set to redefine the role of a lab in the care continuum, so as to say, aligning with the future of value-based healthcare. So what we talk about, from being transactional to converting ourselves into more integrative approach towards care and being part of the care continuum, and also looking at outcome-based models of costing rather than looking at unit-based costing models. So even though the pandemic took us by surprise, many business leaders have seen the various possibilities presented by digital transformation through the technology and the business process re-engineering that led to it. Those diagnostic players that will thrive will have a balanced, in terms of their short-term needs and the longer-term planning. The consideration will be building the acquired resilience, and early building of such resilience is very critical for us to actually get us into the future that we are looking forward to. So how do we actually get into the future? The current situation has presented us with an opportunity So every challenge is an opportunity, and this itself has presented as an opportunity to align ourselves with a more sophisticated and flexible use of technology. And it's also time to re-strategize and re-engineer our business models. So the digital technologies are actually pushing in the field, to become more efficient and more scalable. So therefore, I feel as industry leaders, we have realized that we must reinvent ourselves faster than ever by innovating and modifying care delivery models for integrated and value-based care. To do this, we have started internally the processes like, revamping our website into an e-commerce M-site with PWA for a seamless user experience. So our new website comes with new features like, chatting with experts, searching for the nearest center, booking multiple tests, booking home visits, tracking phlebotomists. So these are some of the features, and also what we are seeing the government's push towards digital health. So in the form of National Digital Health Mission. And we also are collaborating with them as a health information provider to collect and verify unique health IDs, link pathology reports with health ID, and also the digital pathology report with other health information users. So based on the patient's consent. So all these initiatives around customer centricity and digital transformation will help us build an organization that is technologically future ready and able to meet the changing expectations of our patients, clinicians, and employees in the so-called post-COVID era. So all along, I think we have worked on improving and retooling our doctor engagement programs, which have helped us forge stronger ties with the clinicians, even during this pandemic, through the digital models. So I think these are some of the various factors which have come through, from our learnings during the first two waves, and getting us into the whatever the third wave is, which is going to be much subdued compared to the second wave, is what we all hope, with vaccination picking up pace. And we as SRL are also proud to say that we are part of this vaccination initiative, and we have started 4 vaccination centers, two in Mumbai, 1 in Pune, and 1 in Kolkata. So where we have started vaccinating the general public as well. Over to you, Siddhartha.
No, thank you, Anand. Thank you for that, really covering that entire journey. If you, maybe the first question, we'll take up quite a few questions that have come in beforehand and whatever comes up during the course of this conversation. But one broad question, Anand, for you is, as you look at your crystal ball, diagnostic sector is a leading indicator, and you have pretty much a pan-India presence or very broad presence across many states. You said the wave 3 is going to be relatively milder. That's the general perception. But do you see, compared to wave 2 and wave 1, given that people are expecting wave 3, any particular part of the country where you think cases have already started picking up to the wave 1, wave 2 standards? Is there anything different this time you are seeing compared to the other times?
Yeah, I think, Siddhartha, this question of wave 2 and wave 3 is, there is no, I see that there is no, there's no watertight compartment which divides between, there's no walls between these waves. And especially we did find a real sort of a gap between wave 1, wave 2. But I think wave 3 and wave 2 may not have that kind of clear-cut margins which we can look at. But what we are seeing is, in some of the states, especially Kerala, Maharashtra, and West Bengal, and Assam. So these states, we still see higher test positivity rates compared to other places, and we are also seeing an increase in number of cases compared to earlier times. But having said that, we also know that in these places there has not been a much drop in the cases, and there's been a continuous number of cases increasing. But at the same time, these markets have actually fully opened up, and we see a lot of commercial activity, a lot of travel happening. entertainment activities picked up, sports happening. So with all these things, back to work, back to life, back to school, things happening across. So I think that's the difference between the previous waves and this. Here, we have come to terms with COVID, and we have come to terms with living with COVID. And as long as people follow COVID appropriate behavior, which I think 80% of our people do follow COVID appropriate behavior, and with vaccination gaining pace, the third wave is going to be much different from the earlier waves, where even in terms of business, we feel that the non-COVID part of the business is not going to be as severely impacted as it was in the first wave.
Very well. Thank you so much, Anand. Let me take some of these questions. Some of them, I'll just try to club and group them together. The diagnostic sector, broadly, the private sector has really scaled up, right, in terms of both wave 1, wave 2, and now for wave 3. And it's a great example of public-private really, harnessing their efforts towards common goal of fighting a pandemic. What has been your experience, particularly during the wave 1, wave 2? It's also very heartening to say that now a diagnostic chain is participating in vaccination, another very important public-led initiative where private sector is, putting an extended hand or a helping hand. What has been your experience in the last, year, 1.5 years? What are some of the key lessons, and how do you think these lessons can be solidified in the road ahead for us?
Right. Siddhartha, as you know, when we started somewhere in March 2020, we had just 2 molecular biology labs across the country.
Right.
So today we have 20 labs doing molecular biology testing across the country, and we also have another 5 labs in the pipeline which will go live in the next 2 months. So what we can actually see is that as you rightly said, it's a good initiative of working together with the government. The government rolling out the plans, and the private sector getting along and supporting wherever they can. And in terms of improving the testing capacity, I think the private sector played a major role by providing optimal solutions across. Today, if you see, we have almost 70% capacity available. So in case there is going to be a higher requirement of testing during the third wave, we know that we'll be able to cater not only in 1 or 2 locations, but almost across the country with multiple points for this. So I think that is one major learning, and how something like a molecular biology, which was considered as a specialized segment of testing in a laboratory, that has become more like a routine. Something like an RT-PCR is something, probably a word which was used only by a few lab people and a few doctors. So I've never been used by common man, and so now today that has become a common parlance. Everybody uses that word, and everybody knows that term. And that has probably put the particular segment of industry in the forefront as well, because that is one part of the industry where there is a shortage of skilled labor, and that is something which triggered a lot of activities within our organization as well, in terms of how do we actually maintain a bench of people, how do we actually continue training people, how do we actually work with organizations, with universities, with the training centers on upskilling and reskilling our people, as well as hiring the right talent and retaining them, and getting them to specialize in these activities which are required for such pandemic situations. So the most critical aspect is, how do you train, retrain, and engage the employees, so that they are fully involved into it. Another aspect, another key aspect which we saw was that the change in consumer behavior, which is driven by where they want to access digitally, whether it's for booking tests, whether it's for accessing reports, whether it's for accessing doctors, whether it is for archiving and retrieving information about lab tests, booking home visits, getting the service at home. So all these aspects also of change in consumer behavior also led us to fast track our activities on the digital front. and the transformation has been quite rapid. So on one side, on the customer face, you had to look at your mobile app, you have to look at your website, you have to look at your e-commerce platforms and how they are going to be more user-friendly and how they are up to game in terms of handling the customer issues. On the other hand, you also have the back end of the lab, like your laboratory information systems, your total lab automation, your sample tracking facilities, your middleware, your overall database, how it's maintained, what kind of cloud connectivity that you have, the digital pathology systems within your network. So all these aspects, as well as using artificial intelligence and machine learning to understand how you can actually get the data that you have to better use for your doctors and patients. So all these activities happening parallelly and similarly, it's very important change which I feel that has happened because of this pandemic.
Very well said, Anand. As we talk a lot about healthcare, Anand, a lot of the entire healthcare system is very care-centered, right? When we fall sick, we seek care, and a lot of it is hospital-centered, a lot of it is ambulatory-centered. But I think this pandemic has shown that the best possible thing you can do is to be healthy at home. And a lot of what you have spoken about, self-serving, ensuring customers can get served, at the comfort of their home or their communities, is a very important subject. And it was more by necessity where the hospital capacity was choked up this time, where people had to seek those sort of solutions. To what extent do you think these lessons are going to take us in the coming years towards a more robust, home and a community-based center system? And what role do you think the diagnostic sector is going to play in creating that?
So, Siddhartha, as we talked about value-based care, and talking about accountable healthcare rather than just talking about managed healthcare. So there is something called a managed healthcare and there is an accountable healthcare. So when you talk about that, the value-based healthcare is gaining relevance across the country. And when we talk about actually, costs based on outcome rather than cost based on unit price. So when we look at these aspects, I think preventive health is going to be a very key factor in all these things. And with this pandemic, what I feel is that people have also realized the importance of accreditation, importance of having quality laboratories, quality healthcare facilities. Even within healthcare, we have seen that the pandemic has actually improved people's awareness about reaching out to safe and hygienic facilities. So we have seen the mother and child hospitals businesses going up, mainly because people suddenly realize that they don't want to go to a hospital for a delivery, for a birthing process. So that means that there is a concept of wellness that is slowly picking up, and I feel that is going to be very critical going forward in the preventive health basket. So we will have a role being played by diagnostics in this, because diagnostics is actually the first point for preventive health. And this preventive health is not just going to be a few tests. So it's going to be about a combination of blood tests. And also, you also have the wearables and other digital enabled things by which daily data is being taken out. You have the wearables like your Apple Watch and stuff like that, which gives out a lot of health data, and this gets integrated with the lab data, and then you have a holistic algorithm that gives you a more clearer picture of your health. And how do we actually store this data, and how do we actually use this data, and also combining it with more modern things like predictive genomics, predictive algorithms for various things like predisposition for cancer, predisposition for heart diseases. So those kind of factors, and understanding models based on information that we have about the patient. So that sort of what you call, how do you actually create actionable insights from the information that you get from the patient, as well as the information that you get from the community. So to map these two things together, there is population health data and the individual health data. So you have a longitudinal data that you get, because once we have completely transformed digital systems, what we have now is that you have a complete track, like what was your blood sugar 1 year back, and over the course of last 12 months, what are the values that you have, whether it's blood sugar or HbA1c or whatever values that you have. There is a longitudinal report that is available. So these trends on the individual can be compared with what is there at the community level, and there can be broader aspects of both community intervention as well as individual intervention for improving the care outcomes. So that I feel is going to be very critical, and labs definitely will play a very important role in this process of care continuum.
Very nice. Thank you. Anand, one of the things this pandemic has really shown is that there are no boundaries, whether it's at a state level or at a country level. The disease it can spread easily from across all sorts of boundaries unless you are careful. One of the important things it has highlighted is the need for adherence to standards and certain minimum quality levels, which where India needs to be certainly at par with all other countries. If you are to tackle this on a global scale, all countries have to come together and adopt certain minimum standards. There is a problem in India in terms of while NABL standards are being rapidly rolled out, is getting adopted by many labs, including yours, the ones top of the chain certainly are adopting it. But there's a vast number of labs which are unqualified, have variable quality, some of them good, some of them is quality may be questionable. What do you think needs to be done in the next 2 to 3 years to ensure that there is a minimum level of quality, and that is tied to patient safety and reliability of the information that is being done? And what role as an industry we can do and work with government to make that happen?
Thank you, Siddhartha. That's a very, very important question that you have asked. NABL is nothing but ISO 15189 standards. So these are not mandatory, as you know, they're just still voluntary. So labs, as you said, in the organized sector have always looked at NABL as a very important differentiator for themselves. SRL, for example, has the highest number of NABL accredited labs in the country by a lab chain. So we have about 46 labs of ours which are NABL accredited. But at the same time, we have 100,000 labs across the country. And if you see, hardly, about, we can say about 2 to 3% of these labs are accredited. And the accreditation levels and are also very different. So it is like, it's not that the entire lab is accredited. There are a few departments, there are a few tests that are accredited. And the understanding and awareness of the general population about the requirements of accreditation and how it helps is also not there much, even though I feel that the pandemic has fast-tracked this as well, because they found that there is an ICMR approval required for an COVID testing lab, and for that they need an NABL accreditation. So these things were coming into the general domain, and that's how people have also got awareness about what is NABL and what is ICMR and all that. So, but at the same time, as an industry, if we have to keep up with the standards, because what we are seeing is, during the pandemic, we also saw that, some of the countries rejecting reports which were coming from India. So some of the COVID-19 tests which have been done in India, then they're coming out with some different results when they get tested again. So all this is because there is a lack of standard, lack of harmonization, lack of quality processes. I wouldn't say lack of quality, it's rather lack of standardization of quality processes. So if we are able to actually get this with the government's help, if we are able to roll out in a better way, that there are certain minimum standards that have to be followed, and that can be accredited. The accredited forms of institutions can be created, which can help us fast track this process of the quality being adhered by more number of labs compared to what it is now. And there are parameters by which we are able to check that this quality is being adhered to. Currently, that is not there, and that is left a lot of gaps, and we are seeing all these various issues coming up.
Very well said, Anand. Some would say that the real focus of regulation should really be around enforcing standards and quality, minimum quality and patient safety. Price is going to be a derivative of whatever minimum quality that you agree. Hopefully, we along with government can move towards a better quality and a more uniform quality that can be enforced. Moving the pages a little bit, let's kind of take the spotlight to the employees, right? For a large diagnostic chain like yours, I still remember when the first lockdown happened, in about a 4 hours notice, a lot of for the your field workers, the phlebotomists, the center workers, your testers, they were getting stopped. And while the most critical chain at that point of time was to ramp up diagnostic, the people who were going to do were actually getting stopped in the borders and were finding transit difficult. Things got sorted out. But what has happened in 18 months is a very sustained and a very laborious process where everybody has been so, ingrained in serving their customers, both COVID along with the non-COVID customers. So the load factor has been immense. What has been some of the best practices that SRL has adopted in ensuring that the mental health and the physical health of your employees are kept up during this prolonged period? And what are some of your personal advices? I'm sure as a leader, Anand, you spend a lot of time with your frontline troops and your people. What has been some of the feedback, and what has SRL done that others can adopt and ensure that our professionals have a better working environment?
Yeah, that's a very important point that you raised, Siddhartha. I think I have to give it to our employees, who have stood by us, the COVID frontline warriors. So I think, kudos to them, not only to employees at SRL, but I mean, the entire healthcare workers across, they have done a great job. And, I've heard stories of, they're getting even beaten up, to reach the hospitals and labs. Because of the initial phases of lockdown, where there was very little awareness about, even among the law enforcing agencies, there was little awareness about what this lab technician is going to do, what is important for him. So the role of the lab technician was not recognized in the society. So a healthcare worker would normally be a doctor or a nurse. So they would never associate anybody else as a healthcare worker. So that is something, which our employees had to face the brunt of that during those especially during the first phase, the first wave of the pandemic. So I think as far as our company goes, I think a critical part of my vision for the company is also to make sure that our people are happy and excited about what they do, and that we build a company that the family and friends can be proud of. So from that perspective, I think during the COVID, we formulated many processes and policies that were aligned towards employee experience, and increased our focus on our employee well-being and health by implementing several support programs. Taking into consideration the various risks associated with sample collection, we took measures to provide accommodation. So initially, because they were scared to go back home, the phlebotomists who were collecting samples, they were scared to go back home. So they wanted to stay back. They wanted to continue to work. They wanted to serve, but they were scared to go back home, and with the fear of spreading that family. So that was very important for us to provide accommodation, food facility, pick up and drop, increase the insurance coverage to give them that comfort. We increased the insurance coverage to both our on-ground teams as well as their families. And we also provided cash incentives alongside rigorous training to ensure safety and precautions while collecting samples. So we also took care of our people who were hospitalized due to COVID. And even today, all hospitalization expenses are covered for each employee pertaining to sickness due to COVID. Seeing the increase in the number of cases, especially during the second wave, we have also increased our life insurance numbers, how much we have to pay for life insurance and all that. So we have increased that as well. And we also cover the staff for medical insurance as well as term life insurance for this. So we have given a medical insurance coverage to our frontline soldiers, and in case of any COVID casualties, we also provide financial support to their family. So unfortunately, we also lost about I think 3 employees to this COVID, and we provided financial support to their families. And in an attempt to ease the pain of these families, we provide a one-time compassionate payment, medical coverage for their families for 2 years. And in some cases, we have also offered employment opportunities to the spouses and children. So broadly, the 3 key tenets that we are driving as a priority this year is, financial benefits for the employees. As you also know, because of the pandemic, the insurance premiums of life insurance and term insurances have all rocketed. They've all gone over the roof. They're almost like 5 times, 4 times of what it was earlier. And important aspect is people skilling. So how do we actually reskill and improve their overall well-being? So we have already pivoted towards putting employee experience on top of everything that we do, and we are enabling the managers to look at each of these processes and think through what can be done differently. For instance, during the second wave, when we noticed that most of our employees are facing challenges in scheduling doctor consultation or in arranging medical facilities for their family, we actually launched a doctor consultation helpline by using our own doctors network. And we gave a hotline for our employees and their families. So whenever they have a requirement, they want to consult a doctor, they can immediately reach out and sort out their issues, their treatment plans, everything can be worked out. Besides, we are also encouraging employees to continue their focus on reskilling and upskilling in various technical and non-technical areas, aligning to the market needs. So the learning hours also witnessed more than a 40% increase as compared to last year on key topics, mainly because we were working through virtual learning platforms. So I think these are some of the initiatives around the employees. I think we will continue to build on these as time goes by, because this is very critical for keeping the employees engaged and also be ready for any eventualities of future.
Thank you, Anand. Let me just, so my last question to you really is going to be taking a peek into the future. One thing this pandemic has taught us is, if India is going to be a $5 trillion economy, it's important to have a robust healthcare system. Simply because this pandemic has shown what a devastating impact, an economy, people's livelihood, you can have if healthcare as a sector is not secured well. One of the big things ahead is going to be non-communicable diseases, right? And we read in newspapers every day in a headline, somebody was absolutely healthy, something fatal happened. And many of these cases, the prevalence of cardiovascular cases, hypertension, diabetes, cancer, the way it is, increasing in India, diagnostic sector has a major role to play in raising the level of awareness, shaping, health-seeking behavior, as well as reinforcing the need for individuals and government reinvesting in preventive health as opposed to curative side of it. What can the leading diagnostic chains like yours and the sector as a whole can do to reinforce that belief in people that a stitch in time is worth 9, and that is the old adage, and in investing in individual health when you are not sick is so paramountly important.
Right. So that's something very clearly an imperative going forward, is what I feel, Siddhartha. I think when it comes to, like you said, stitch in time saves 9, there is also prevention is better than cure. So all these adages are there, but at the same time, what we find is, people ignore health. Health is the last priority. And when you talk about government, as you rightly said, government focuses more on public health. And under public health, they generally have communicable diseases, like your cholera, your tuberculosis. You have now COVID. You have dengue. So these are the various diseases that come under them. The non-communicable diseases, which is a much larger the elephant in the room, that is simply not being addressed even at the public health level. So I think that is something where the government should look at not just the individual's prerogative, but the government also should initiate activities towards how we can screen larger population. Towards what we're seeing today is also that it's not just the urban population which has got these NCDs, but we also find a large rural and semi-urban population, migrant workers. We have a lot of unorganized sector workers who are also succumbing to such issues of like heart attack, chronic liver disease, you have hypertension, all these happening, diabetes. It's no longer that it is restricted to one strata of the society. So on one side, on the individual side, as long as there is awareness, we create more awareness, and the resources are there with them, so they can approach healthcare institutions like diagnostic laboratories and get themselves tested, screened periodically. They can get into a proper program based on their age group in terms of what kind of screening they should undertake. But what about people who are not even aware that such things exist, and who don't have the wherewithal to get themselves tested? They don't have the time to get themselves tested. So I think it has got to be more of a public-private initiative, where the public sector can work in tandem with private sector to roll out schemes by which we are able to cover a larger population in terms of screening initiatives and surveillance initiatives towards the prevalence and incidence of NCDs across various states. So I think this is one aspect which was started 10 years ago. I think it was 15 years ago by the government when they rolled out the NCD plan. But it was implemented very sporadically in some states, and we found that it was not a national level initiative under the National Health Mission or the National Rural Health Mission. So it was more given to the states to sort of try to figure out at the district levels, but which really didn't pan out. So I think a larger initiative from the state side is also very important. At the same time, from the individual side, I think creating more awareness and making them look out for options for testing, options for finding out what is the best solution for them, tailor-made solution for this particular age group or their risk group would be ideal when we look at preventive health.
Who knows, the next big pandemic, the silent pandemic approaching us, maybe the NCDs. And it will take, as you have rightly said, all hands efforts, public health, financing, real public strong communications campaign around public awareness, and an all hands effort for us to really stop that in the track. With those words, Anand, thank you so much. Your viewpoints have been very, very clear, concise, forward-looking, and you have given us an insider peek into how the diagnostic sector not only performs, but how it's gearing up to deal with not only this particular pandemic, but really implement the lessons from this pandemic in the road ahead, in rebuilding, in making, building a more robust healthcare systems, made in India, for India and rest of the world. I would like to thank everyone who took the time to join this session today. For those who couldn't join today, this video would be put out in the social media channels. There is also a microsite for this, the NATHL Leadership Reach Out series. This discussion today would be transcribed and would be put out there along with the video link. We certainly hope that you can forward it to many of your peers, workers, many of your colleagues who couldn't join us today. And we hope to come back very soon with another discussion series with another top leader in the industry very soon. Please accept our deep gratitude, Anand. I thank all the organizers, Health Biz Insights, the NATHL Secretariat team for putting this together, and the entire SRL team. Thank you for your collaboration and helping us put this episode out. With those words, have a wonderful afternoon ahead, and thank you for everyone for joining. Bye-bye.
Thank you, Siddharth, and thanks, NATHL, for this opportunity. Thank you.